So when it comes to aging of a face, it's really important to understand that every area of your face ages differently. Yes, everything goes down, everything goes south because we live in an environment with gravity. But this is not necessarily all going down in a parallel fashion. We have bone structures, and by the way, the bone is changing as we age as well. So the bone structures and the vectors on the bone are changing itself. But because the bone of the skull has different vectors, different tissues are dropping in different vectors. Think of a skier going on a black piste versus a blue piste. The next tissue is the soft tissue. Soft tissue can be very strong, can be very, very soft. Some areas are very fatty or have more muscles. So soft tissue is changing in the face in different areas differently. And as a good surgeon, you have to be able to see how these changes are occurring, what vectors are happening. I'll give you an example. The lip drops as we age, but depending on the tooth arch, it drops differently. And the sides drop more than the center, and then you have loss of vermilion height. These things have to be analyzed, ideally with pictures of a patient that was younger. The brows drop in 3 different angles. The tail of the brow drops vertically. The center goes together because we frown all the time, and then over time the tissue gets softer and the muscle actually wins and brings everything together. So a good brow lift is actually working at 3 different angles. So rejuvenative surgery is based on analysis and understanding the changes that happen on the face due to the vectors. And these vectors are based on your facial anatomy, so individual. It's important to understand this, it's important to see this so that you can plan your surgery accordingly.